The pain starts in your back, but that's not where it hurts the most. It shoots down your hip into your thigh, past your knee, sometimes going all the way down to the foot. And here's the part that scares people. The leg pain is often worse than the back pain. So you start to wonder if something is wrong with your leg, but it's not your leg. I'll show you exactly what's happening. Where your pain travels tells you which nerve is involved and the one thing you need to rule out today. The simplest way to understand it, your spine is where the electrical wires start. Each nerve leaves your lower back and runs all the way down your leg. So when a nerve gets pinched up here at the spine, you often feel it down there in the leg. The problem is at the source. The symptom is at the destination. I'm Dr. Omar Ramos, a spine surgeon, and this is the conversation I have in clinic almost every day. Most of the people I see are terrified that their leg pain means something is permanently damaged. Usually it doesn't, but there's a pattern you have to know the difference on. Not all leg pain from the back is the same. There are two very different types, and telling them apart is the whole game. The first kind is a deep, dull ache, buttock, back of the thigh, hard to pinpoint. That's often referred pain. The tissues around your spine are irritated and the ache spreads to the neighborhood. It's usually annoying, but it's not dangerous. The second kind is different, a sharp electric burning line, and it follows a specific path down your leg, like someone drew it with a marker. That is radicular pain, a nerve root itself compressed or inflamed. I'm describing patterns, remember, not trying to diagnose you. Two people can feel nearly the same thing for different reasons. The pattern is a clue, not a verdict or a diagnosis. Now, here's what most people are never taught, and it's the part that'll make your own pain make sense to you. The path your leg pain takes is a clue to which nerve is involved. So let me give you the map. Your lower back has several nerve levels stacked on top of each other, and each one tends to send pain and numbness down a different route. If it runs down the front of your thigh toward your knee and shin, that pattern often points to the L4 nerve. If weakness shows up, usually it'll be difficulty straightening the knee. If it runs down the side of your leg to the top of your foot and into your big toe, that's a classic L5 pattern. The tail can be a weak big toe or that foot drag I mentioned. And if it runs down the back of your calf to your heel or little toe, that points lower towards the S1 nerve. There, weakness shows up when you're pushing off, like going up on your toes. Now, this is a map, not a diagnosis. These patterns can overlap. Nerves vary from person to person. Two different levels can feel almost identical, and your body doesn't always read the textbook. So use this to understand your pain and to describe it better to your doctor, not to diagnose yourself or decide it's nothing. The path is a clue that points. The exam and the imaging together are what confirms. Let me show you how this actually looks, because the map makes more sense with a face on it. Picture a typical story I see all the time. Someone in their 40s bends to lift something up, feels a twinge in their back, and thinks nothing of it. A day later, the back pain fades, but now a sharp line starts running down the side of the leg, all the way down to the top of the foot and the big toe. By the end of the week, the leg pain is the main event. The back barely hurts anymore. They come in convinced something is wrong with the leg itself, but the leg is fine. The path, side of the leg to the top of the foot, is following a single nerve. The trouble is at the spine, where that nerve exits. Notice what happened there. The back pain got better while the leg pain got worse. And that switch is exactly what fools people. It doesn't mean it's spreading or getting more dangerous. It often just means that the irritation has settled onto that nerve. I'm not describing you specifically, yours may look different. And that's the point. The pattern points to something, but it doesn't prove it. So what's actually pressing on these nerves? Usually one of two things. A disc pushed out of place or the space around the nerve narrowing over time. Different causes, same result. A nerve at the source, a symptom down the leg. Now the part I told you to stick around for. Most leg pain from the spine is not an emergency, but a small number of patterns are, and you need to know them today. Get evaluated urgently, same day, if the leg pain comes with any of these. New numbness in the area that would touch a saddle, between your legs, upper thighs. Any loss of control of your bowel or bladder, or rapidly worsening weakness, a foot that's starting to drag, a leg that's giving out, Those are not wait and see symptoms. They can mean a nerve is under enough pressure that time matters. If that's you, stop the video and get seen. And if none of those are happening, that's generally reassuring. It means you likely have time to let things calm down and get evaluated the normal way, not the emergency way. So, what do you actually do in those first few days? Let me give you the general principles I find myself repeating most. First, keep gently moving. Total bed rest tends to make this kind of pain worse, not better. You don't have to push into sharp pain, but short, frequent walks and easy position changes usually beat laying still for days. Second, find the positions that calm the nerve down and use them. For a lot of people, that's small, frequent movement rather than one long stretch of sitting. Third, give it a little time before you panic about the MRI. Nerve pain often settles over weeks, not hours, and early imaging doesn't always change what you would do first. None of that replaces being examined though. If the pain is severe, not improving, or you're worried, get seen. This is the general path, not a personal medical advice for your situation. Here's what surprises people most, and is the thing I most want you to leave with. You can have a scary looking MRI and mild symptoms, or a clean looking MRI and real pain. The picture and the person don't always match. Studies have looked at people with no back or leg pain at all and scanned them anyway. A large share had disc bulges or herniations sitting right there on the MRI, and they were feeling no pain at all. So a herniation on a report doesn't automatically explain your pain, and it doesn't automatically mean surgery. What matters is whether the level on the scan matches the path of your symptoms and what the exam shows. That's why we read imaging and symptoms together, never the picture alone. And it's why the majority of this kind of nerve pain gets better without surgery. The early goal is calming the inflammation around the nerve and giving it room, not chasing an MRI image. So the pain starts in your back, but you feel it in your leg because the nerve to your leg begins in your spine. A dull spread of the pain is usually referred pain, but a sharp line down a specific path down the leg tends to be radicular or nerve pain, and which path this follows is a clue to which nerve is causing the issues. The red flag symptoms are the ones you never wait on, and the MRI only means something when it matches your story. If you want to go deeper on that last part, why your MRI might look terrifying but not match how you actually feel, that's the next video right here. I'm Dr. Omar Ramos. I'll see you on the next one.